Hey guys, it's Amber here, your nurse practitioner and nurse injector, and today we're going to talk about could and should. Okay, so all the time I am asked as a nurse practitioner why I do not prescribe the weight loss medications. This is going to be the new fad you guys have heard about, whether it's the Ozempics, the semaglutides, Wegovy's, and here's my take on this. So these are medical pharmaceutical products that I personally feel are being abused in what we do. I understand the money that can be made in these. However, if you're a patient of mine, you know we are a patient-driven practice, not a profit-driven practice. And unfortunately, that's the ugly side we are starting to see of this industry. So that's where I say, could I prescribe these things? Yes. Should I? No. What we are seeing is patients are not being monitored. They are not being educated. They are being sold these injections and they are losing weight. We're seeing the downside of that. So these patients are not being educated on how to eat, on the protein they should be getting. Studies, if you actually read, which we've looked into, the education of it. I still stay up on it because it affects my patients and what they're doing. Patients who are eating the protein they are supposed to be are actually losing more fat, less muscle. However, when this education is not being performed, you might be, the size 2, the size 3, size 4 you want to be. However, you're noticing your nails are brittle. You're noticing hair loss. You're noticing the Ozempic face, which is where it's more concave. You're losing all the healthy benefits, but you're losing fat, which doesn't make sense. So as a medical provider, I'm asking you to do better. As a patient, I'm asking you to educate yourself. They should be doing a body analysis. We should know how much fat you're losing versus how much skeletal muscle mass you're losing. For patients that are losing more muscle than fat, that's a problem. It's not healthy. For patients that are having the hair loss, the brittle nails, even patients complaining of dental problems, we need to be assessing the nutritional value. We need to be doing labs and making sure that this is being done in a healthy manner. So as far as we're concerned at our practice, again, I pray we find a provider soon that I trust to take care of our patients. However, we are not a sales-based practice. I don't want somebody that's going to sell you things. I want somebody that's going to invest in you the way they invest in themselves and their education as far as how they're taking care of you. We want to focus on lifelong goals. I feel like the Terre Haute location is very good at that. They focus on building a healthy, happy person, mentally and physically, emotionally, not just selling you something so you can lose the weight. So that's where the could I, should I comes into play. I hope you all that are using the medications are using them safely and are loving the results.